not just in Nigeria, but taking it beyond the shores of this country into the West African sub-region. And to discuss about the health sector this morning, I have here with me the CEO of West Africa Health, Dr. Wale Alabi. Good morning.
Good morning, ma'am.
Good to have you here with us.
Same here.
Now, there are quite some things that I don't understand, which I would want you to shed more light on for me this morning. When we say West African Health, what are we talking about?
Actually, West African is a B2B platform that promotes the investment in healthcare in West Africa, and most especially in Nigeria, which is the giant of Africa.
Yes. Okay. So let me begin, this way. What informed your decision to invest in the healthcare sector?
Actually, we have provided a platform for investment in healthcare from across the world.
Okay.
We noticed in the last 10 years there was no platform in Nigeria or Africa or West Africa where there could be a platform where private investor, public investor from the global village could invest in Nigeria, Ghana, or any of the West African countries. That's why we provide this platform. And these are 90
When you say platform, what exactly are you talking about?
Okay, we have created a platform whereby if you can come in as an exhibitor providing services, a manufacturer, or if you are looking at understanding the health sector in Nigeria or West Africa. It's a 3-day platform we provide. It's at a hotel.
Okay, so basically when you say platform, you're talking about probably things like exhibitions and all of that.
Yes, exhibition and conferences and workshops.
On the
healthcare.
healthcare.
Yeah.
Okay, now, I want us to, because it said that charity begins at home.
Yeah.
I want us to look at the health sector in Nigeria. What is your summation of where we are today?
I think it's a journey that started and we are doing well, although it's challenging, like every other infrastructure in the country. But I'm sure we're going to get there. Now there's about to be a revolution in healthcare space in Nigeria. A lot of investors are looking at investing in healthcare in Nigeria, either from providing of health facilities to manufacturing of pharmaceuticals, and even some of them are looking at even making Nigeria a distribution hub.
Okay.
So there's a lot of attraction in the healthcare in Nigeria because of what we have been doing. We promote Nigeria globally from Asia to Europe to US.
Okay. Now, is this basically for medical doctors alone?
No.
Or how can you invest in the healthcare sector, without
That's
being a
very
medical
interesting.
doctor?
It's a very interesting question because we have a strong financial angle whereby we have investment bankers involved in this. They showcase the best practices, the success stories. And what we've noticed here is that most of the investment even in health sector in Nigeria are not done by doctors or pharmacists. They are done by non-medical people. Because now it's very obvious now that somebody has to pay for healthcare.
Yeah.
There's no free lunch anywhere.
Yes.
Either if government is not paying, the private sector has to pay.
Now, somebody has to pay for healthcare. Something gives me a cause for worry. But maybe before we come to our cause for worry, I want you to shed more light for me and to our viewers. I hear about medical tourism. I know that one nation that thrives so much on medical tourism is India.
Big time.
We have a lot of people who are going there on a daily basis. In fact, the amount of Nigerians who are going to India to seek medical attention is enormous. What is the relationship between medical tourism and this West African health?
Interestingly, I chaired the Nigerian India Chamber of Commerce, the health committee, and we've done a lot of study about the outflow of patients from Nigeria. Minimum of about 5,000 to 7,000 patients leave Nigeria every month to India.
Yes.
Minimum of about $200 million leave Nigeria every month
Yes.
to India. So I actually had a meeting with the Nigerian ambassador in India of this. What do we do? We should actually look at as an opportunity. It's obvious that India has something to offer.
Yes.
What can we take from India? Because of that, now we are looking at an investment forum where Indians can partner with Nigerian hospitals and help even build capacity. Some of them are even looking at investing in Nigeria. And India has shown that health is business.
Yes.
So a lot of Nigerians now, that non-medical people, are looking at how can I invest in healthcare. The platform gives you how to understand healthcare, where to invest, the opportunities, and what has been done.
We're still talking about promoting, the healthcare sector in Nigeria. And you just, made a point here about India collaborating with Nigeria, some of them coming to even establish their hospitals here.
Very well.
Is there something about Nigeria that, you know, prevents these mighty plans from working? Why do I ask this question? I particularly know of an Indian hospital that has come to establish in Nigeria, but things are not going smoothly. And I hear that the so-called Nigerian factor has even, you know, infiltrated the system there.
Actually, there are a lot of barriers to entry, obviously. And I know the Indian hospital. Obviously, there's going to be challenge. There's going to be first entry disadvantage too. Sometimes there's a first entry advantage. But what has happened is that some of them have looked at the best practices. What are the challenges? What are the obstacles? In terms of regulation, we actually have challenge of regulation in healthcare. So a lot of them are looking at those barriers and how to surmount this. And I can rest assure you that apart from even the Indian investors, Nigerians are now investing in healthcare. They are looking at it as a business itself.
Okay, so now still talking about the healthcare sector, because it's, you know, been worrisome for quite a while. Taking a look at, you know, the rate of mortality, maternal mortality, infant mortality, and all of that. What and where is the future of the healthcare investment, you know, leading to?
Interestingly, it's just about the root cause. We need to build capacity in the health sector, and the present Minister of Health is doing a lot of work in that. The training curriculum, they are working on all that to actually, because we are in a modern society.
Yes.
It's a technology age. We have to look at how we can use technology to enhance modalities of treatment. So which we are doing that presently. It's going to take us a while, but it's going to happen. We are waiting for the National Health Bill to be passed.
Yes.
It's going to change the whole health space, the way healthcare is practiced in Nigeria.
Still looking at this issue, you know, of the healthcare sector, people, even investors, when we take a look at, you know, the situation generally, looking at the economy and everything, foreign investors have been encountering problems, you know, coming to establish in Nigeria. The government has been asking Nigerians in the diaspora to come back and invest in this country. Yes, because it is, you know, the only nation we have. But really and truly, there have been issues. Electricity has been an issue. Safety, security has been an issue. How do you hope to surmount all of this?
To be honest with you, anywhere where there are actually challenges, there are a lot of opportunities. It's going to create a lot of barriers to entry for people that actually are not ready to surmount this. I can assure you there are a lot of Nigerians in diaspora that have set up very good practices in Nigeria. Even during West African Health, we actually have a dinner for Nigerians from the diaspora.
Okay.
They're having a dinner, a cocktail party. Because a lot of them are on ground. We want to celebrate what they are doing. A lot of what they are doing, Nigerians are doing a lot of knee replacement, spinal surgery. They are done in Nigeria, but they are not celebrated. Nobody knows.
Yeah.
India is actually doing a lot of publicity. Nigerian doctors are not allowed to advertise.
Why is this so?
It's part of the medical and dental regulation. You cannot advertise as a doctor. You cannot sell yourself. You cannot sell your service. So now, you see, we have to look at all those kind of challenges. There's a lot of capacity in-house. We don't have a portal in Nigeria, a medical health portal where you can actually Google and say, hey, I want to do a knee replacement. I want to do a spinal surgery. I want to do I want to do laparoscopy surgery.
Yeah.
They are done. There are so many surgeons in Nigeria doing a lot of things.
That's
and investment is coming into cancer, into cardiology care in Nigeria. They are coming. There are things are happening, but nobody knows. So we are actually trying to provide a platform, the health portal, whereby when you Google information on Nigeria, you can actually see a lot.
Okay, you say a lot of these things are being done.
Yeah.
I agree with you. I know that they are being done. But between you and I, we know that they're pretty expensive here. What is being done, you know, to ensure that these services, even when they come, are readily available to the pure water seller,
Common man on the street.
Everybody. The pepper seller in the market,
I am with you totally.
And of course, the man who has quite a lot of funds, you know, to do this. How are we going to ensure it's readily available?
We need to have a strong insurance policy whereby you don't have to pay out of pocket. We have a national health insurance, a strong national health insurance policy where everybody is insured, so that you don't have to pay out of pocket. So it's easy to assess this care.
Okay.
You don't have to pay 500,000 naira, 300,000 for a surgery.
Yes.
Because most of the time, most of the care we need is primary health care.
Yes,
exactly. Just 3% of us need these surgeries, which we can take care of.
Well, we're coming to the end of this discussion, but I must ask you, because we've been talking about, okay, you just mentioned the insurance policy on health and all of that. Based on your experience so far, what has the government, what has been the level of participation on the government in terms of support?
Interestingly, we have very strong support from the Federal Ministry of Health in Nigeria, from the Federal Ministry of Health in Ghana, across West Africa. We have very strong support from the Commissioner of Health, Honorable Dr. Jide Idris.
Okay.
He's really supported us in health, in all what we've been doing.
All what you've
and
done.
I must even give kudos to the Nigerian Medical Association, Association of General Practitioners, the Lab Association, the Nursing Association. It's actually a whole team approach that we have used.
Fantastic, fantastic. I mustn't let you without asking this last question, and very briefly. What are the requirements, for anyone who wants to participate in what you're doing?
We have 4 segments. You can be an exhibitor, come and participate in the exhibition. We have a large group of people from abroad and within the country participate in the exhibition. You can be a visitor. You can come in if you're a doctor. You can come in and we have a training program, about 8 seminars.
Okay.
One in cardiology, pediatrics. We have a nursing program, a medical lab program.
Okay.
We have a CEO forum, medical leaders forum,
Yes.
where you learn how to manage the new hospitals, the new model of hospital.
Okay.
Then we have a forum for consumers.
Okay.
Patients, you can come in. There's free medical screening. Yes.
Okay.
It's free. So some of the big labs in Nigeria are offering medical screening, so people can come in. They can have information.
Yes.
We can have their diabetes check and all that.
And the hypertension checks and all of that.
Well, even there's a free oncologist screening.
Cancer screening. That's good. That's very good. Okay, thank you very much, Dr. Wale Alabi, for being with us this morning. At least you have, I know that I have been educated this morning. I know that, you have opened my eyes to, opportunities that are bound here, and that really and truly Nigerians do not need to go outside the shores of this country anymore as much as we do, to seek medical assistance. I just really hope and pray that, at the rate it's going, it will keep improving and getting better.
We are very sure the next 5-10 years the space is going to change. We are very sure of that.
Beautiful.
Thanks.
Beautiful. Thank you so much for being a part of Morning Right today.
Thank you.
I have been speaking with the CEO West Africa Health, Dr. Wale Alabi, and we've been talking about the provision of qualitative health care services in Nigeria. Morning Right continues now as we take this break.